Hello, this is Hilda Gooding from Elastic Stability, cooperation with Robert Schleip and Fascial Fitness. Hello, Robert.
Hi, Hilda.
I just want to ask you today about the fascia. How should we treat the fascia in exercising?
Well, first go to and study with Hilda. And as you are starting to explore the work of fascial fitness now here in Scandinavia, I think people will be very open. Because Scandinavia is where our forefathers got into gymnastic movements there. And also, like in Norway, in many other countries there, you have the cross-country skiing. So we Germans have been into power, into muscular power, and the more effort, the better the effect, you know, and what doesn't kill you makes you stronger, so all this. But what you already have in Scandinavia and what you have been teaching before you discovered fascial fitness is that you bring elegance in the movement. And elegance was a mystic factor in the past, and now the lens of fascia allows us to dissect elegance. You know, how come something looks more elegant? Because in the same movement you have less muscular effort and you use more the elastic recoil of the fascial tissues. But then the fascia needs to be unglued or less glued together. It needs to have the crimp, so the wave formation, and also you need to have a nervous system that has a refined sense for elegance, for lack of effort, and for efficiency in the movement. And you need to be at home in the body. And that's where your background, coming from a rich Pilates background and exploring different movement therapies, is ideal for applying that to fascial fitness.
Great. So what would be, if we talk about just one thing, what would be interesting in the future, both in rehab, exercising, and in sports and fitness, when we take the approach of fascia? What is the most important part to change? Where should we change if we talk about a general approach to exercising what we see today? What is the most different thing we should approach in the future when we have the fascia research?
Maybe it's to go beyond looking for the correct way of doing an exercise. So you start with what you think is the correct way, whether it's in rehab, whether it's in teaching a dance movement, whether it's in Pilates, but then you bring in angular variations, because then you get into the membranous fascial structures, and you look also for little mini bounces in the long position. But you do that with a sense of mindfulness in the client, with body friendliness. So it's not this is correct and this is wrong, it's how many different ways can I do the movement and which twisting is better today. So you may start to do your rehab movement with the back, right there, with your knee over your third toe or whatever it is, but then you go a little bit more medial and see what fascial tissues that affects there. But you do that with a sense of giving stretch sensation to the fascial tissues in your back in order to train them, that they get more elastic, so that your goal in the future is a more resilient, a more elastic body, so that you can apply tension and it doesn't tear, it bounces back. And that's why I think your name of Elastic Stability fits very well.
Great. Thank you, Robert Schleip.
Thank
Looking
you.
forward to cooperating with you in the
Yeah.
future, and hopefully I see you on a course in Elastic Stability soon.
Study with Hilda.